I've got the patient up, he's sitting at the edge of the bed. Balance is pretty good, I'm not too worried about that. But what we're going to do is just kind of go through step by step what to do for moving a patient, okay? So the first thing I want to do is get their permission to put a gait belt on. So I usually just say, I have my gait belt here. I call it my just in case belt. Do you mind if I put this around you? You do mind if I put it? No, I don't mind. It's okay, you can mind. I just need I need to convince you that you need to wear it. No, so I'm going to put this around there. There's a couple different ways. Some patients, if you come at them like this, they don't really appreciate that you're going to, like strangle them or whatever. So I just tell them, I'm going to just put this around you over your head. Okay, we're going to just come around. You can do it this way, but you got to make sure you're not smacking them in the face or anything. Or just come in and give them, I'm just going to give you a little hug here and come around. Now placement, I know Jamie went over this, but you want to, there's different theories about this. I like to place it nice and low around the hips so that I know that that's where I'm going to be moving the patient. It's going to move up on me anyway, and so I like to start low knowing that it's probably going to rise a little bit. Plus, I'm going to just do a little demonstration here. What people tend to do is they tend to put it a little higher, and they come in, and remember, you don't want to just, okay, we're going to just get that going. Okay, you don't want to do that snug like that. You want to have it about 2 fingers in there, and I like to bring it off to the side. A lot of people like to have it high, but what they tend to do, if they're doing the transfer wrong, they kind of block the person's knees and then they use the gait belt and pull up on their ribs. How does that feel on your ribs?
Not too nice.
Not too nice. And what they do is they pull them like this to get them up. Now you imagine he's a young man, he's got healthy bones. If we advance his age to, 70, 80, 90, and he's got weaker bones, he maybe has osteoporosis or something like that, I could break a rib very easily by doing that. So that's why I like to put it down lower. So I like to start down on the hips, nice and low. And you can tuck the tail in it if you want. Finish up a nice little bow. Pull down their shirt. Okay, all right, so we've got that on. So now I need to get him to the edge of the bed because we just learned about scooting to the edge because I don't want to move this much of him. Okay, so a couple ways. I can ask him if he can scoot forward. So if I ask him and he's able, that's great, but if I ask him and he's not able to move forward, then I've got to help him. So we're going to assume that he can't move forward. So I'm going to help him. There's a couple ways. What a lot of people like to do is they like to push. If they're in a chair, they like to push and kind of hip hike this way. They like to push and thrust their hips forward in the surface. On the bed, that's kind of hard. So I like kind of walking the hips forward. I apologize for the onions. So I want to get both of his feet firmly on the floor, plus I want to get him out further for an easier transfer. So the way we're going to do this is, I'm going to have you just put this hand out. I want you to lean to your right. I'm going to help you lean. I'm going to support your trunk. I'm going to just come in here and bring your hip forward. So I kind of come in, I place the thenar process there, and I just scoot him that way. And then we just go to the other side, lean over that way. Okay, and I just kind of walk him out to where I feel like we need to be. Okay, that's a pretty good start right there. He's out far enough. I could bring him out further, but you need to remember that on mattresses, they tend to squish down. Like that middle bed is a little softer than these mattresses. You get someone too close to the edge on a mattress, it starts to squish down and they can actually slide right off the bed. So you don't want to bring them out too far. Okay, so we're here, we're ready, we're good to go. I have a little, you saw Margaret actually, she put the person at the edge and then she transferred them to more of a 45-degree angle to the chair. And so that's what we're going to do now. So, and Margaret talked about you want the chair at 90 degrees. I'm not so much a stickler at that. 90 degrees is fine, but if it's at a 45-degree angle, that's also fine. The reason I think that that's fine is if a person were to fall there, if they fall there and they can make it to the floor, I'm going to give them bonus points. Okay, that's a very small space. People don't tend to slip down into that space. So 45-degree angle or a 90-degree angle is fine. Okay, so we take the armrest off of the side that we're going to transfer to, and you can put it on the floor, you can put it on the bed, just don't put it in your working area. Now let me just talk real quickly about your working area. You want to clear everything out of your working environment. So you'll come into rooms and there'll be a mess. There'll be a bedside table, there's going to be TVs, there's going to be garbage and a wheelchair and a walker and all this stuff in this little space, because of course there's a roommate on the other side and they have just as much of a mess on their side. So you need to clean up your area before you even try to transfer somebody. Don't work in a mess, because that's just going to make a very unsafe situation for you and the patient. If I'm trying to transfer someone and I get him about halfway and I move my foot and I step on something, I could lose my balance and we're both going to go down. Okay, I've worked in nursing homes where you have a TV on the bedside table and the cord drapes across over here to the plug-in, and so you've got this cord going across, you know, and you're trying not to knock the TV off of the table, and it, you know, all these things, just, it's a nightmare. So clean up your environment before. All right, so we're ready now to transfer. We're going to just do a squat pivot transfer, and the first thing we're going to do is just, now I could ask the patient, are you able to move over? If he's able to move over, I'll let him kind of scoot himself over, and I'll help him as he needs help with that. If he's not able to, then I'm going to do that for him. So how do we position ourselves when we go to transfer? It's basically a big hug. And one of the hardest things for you guys is getting close enough. You tend to get closer to your actual patients than you do to each other. It's like this weird, I just met you type of thing, and I'm not sure that I really need to get that close to you. But you actually need to get close enough so that your center of gravity is very similar. Okay? If you try to come in and you're way out here trying to transfer somebody, again, you're too far apart. Okay? You've actually got to come in and have them give you a hug, or be close enough where your shoulders are meeting. Okay? So let's demonstrate that. So, okay, Dustin, what we're going to do is we're going to just move you over a little bit in preparation of coming to the chair. So what I'd like you to do is I'm going to position this foot. Okay, we're going to just turn that a little bit so that when you go, your foot will automatically turn. Okay, and I'm going to just do a little technique where I put both of my knees on the outsides. All right. What I'd like you to do, if you can, I'd like you to put this arm up on my shoulder. Can you do that? Good. And then I'm going to have you lean in, and I'd like you to turn your head. So there you go. All right. So in this hand here, if you can, I want you just to come up and give me a little hug there. And we're going to just go over a little bit. Okay. So we're going to lean forward, and then we're just go to your left a little. Ready? 1, 2, 3. Okay. And he helped me a little bit. All right, which is fine if the patient can help you. So now we're in this position. So did you see how I got him close? If they're able to put their hands up on your shoulders, that's fine. What you don't want them to do is to put their hands around your neck. We don't want this, okay? We don't want them pulling on our neck and wrenching our neck and causing injury. So the hands go on the shoulders, or they go in their lap, but not up around your neck, okay? So now we're going to go to the chair. So the same thing. This is step 1. It's a preparatory step. And we just basically do the same thing again. So this time we're going to go into the chair. All right. So I'm going to have you do all that again. Just reach up, lean in. Okay. And don't help me as much. 1, 2, 3, up. And into the chair. And then back.
Patty, were you